Welcome to EWAL Review, where we bring you audible versions of end of rotation exam questions for people on the go. This episode will focus on family practice. I will start by reading you the questions, providing the options, the correct response, and an explanation as to why. Let's begin. What is the most common cause of hypertension in children under 6 years of age? A. Renal artery stenosis. B. Renal calculi. C. Idiopathic hypertension. Or D. Renal parenchymal disease. I'll give you a second to review. The most common cause of hypertension is renal parenchymal disease, and a urinalysis, urine culture, and renal ultrasonography should be ordered for all children presenting with hypertension. Renal parenchymal disease encompasses various disorders that affect the glomeruli, interstitium, tubules, and small blood vessels of the kidneys. A 70-year-old male with a history of hypertension and diabetes presents with a 2-month history of increasing paroxysmal nocturnal dyspnea and shortness of breath with minimal exertion. An echocardiogram shows an ejection fraction of 25%. Which of the following medications should be discontinued in this patient? A. Lisinopril. B. Chlorthalidone. C. Metoprolol. Or D. Pioglitazone. I'll give you a second to review. The correct answer is D. Pioglitazone should be avoided because, like other TZDs, it causes water retention and can complicate the disposition of someone with heart failure with reduced ejection fraction. Next question. A 72-year-old African-American male with New York Heart Association Class 3 heart failure sees you for follow-up. He has shortness of breath with minimal exertion. The patient is adherent to his medication regimen. His current medications include lisinopril 40 milligrams twice daily, carvedilol 25 milligrams twice daily, and furosemide 80 milligrams daily. His blood pressure is 100/60 with a pulse rate of 68 beats per minute, which is regular. Findings include a few scattered bibasilar rales on examination of the lungs, an S3 gallop and examination of the heart, and no edema on examination of the legs. An EKG reveals a left bundle branch block, and echocardiography reveals an ejection fraction of 25%, but no other abnormalities. What's the appropriate next step? A. Refer for cardiac resynchronization therapy. B. Increase furosemide. C. Start metoprolol. Or D. Admit for emergent catheterization for the left bundle branch block. I'll give you a second to review. The correct answer is A. Using a pacemaker-like device, CRT aims to get both ventriculars contracting simultaneously, overcoming the delayed contraction of the left ventricle caused by the left bundle branch block. These guidelines were refined by an April 2005 AHA Science Advisory, which stated that optimal candidates for CRT have a dilated cardiomyopathy on an ischemic or non-ischemic basis, an LVEF of less than 0.35, a QRS complex of greater than 120 milliseconds, and sinus rhythm, and are NYHA functional class 3 or 4 despite maximal medical therapy for heart failure. Next question. Which of the following therapies is associated with decreased mortality in those with COPD? A. Albuterol. B. Oxygen therapy. C. Influenza vaccine. Or D. Inhaled glucocorticoids. I'll give you a second to review. The correct answer is oxygen therapy. Only 2 therapies are proven to reduce mortality in those with COPD: smoking cessation and oxygen therapy. The other therapies are beneficial, but none reduce mortality at a similar efficacy. Next question. A 60-year-old male with a 25-year smoking history complains of a chronic productive cough. Physical exam reveals restricted inspiration and a diffuse expiratory wheeze. Of the following, which would be an expected finding in this patient? A. Increased heart sounds. B. S1 splitting. C. Increased inspiratory time. Or D. Decreased heart sounds. I'll give you a second to review. The correct answer is D. Decreased heart sounds are expected in a patient with COPD due to hyperinflation of the lungs. AP lat diameter would be increased in those with COPD. A prolonged expiratory phase is a common finding in COPD because of endothelial damage, and a split S1 is more strongly associated with the bundle branch block. Next question. Which of the following would be the most likely diagnosis and a 45-year-old female landscaper that presents with reproducible chest pain in between her sternum and rib cage. The patient has no significant past medical history, takes no medication, and her ECG is unremarkable. A. Myocardial infarction. B. Costochondritis. C. Aortic dissection. Or D. GERD. I'll give you a second to review. The correct answer is B. This case presents as costochondritis based on the lack of significant medical history and ECG findings. MI does not present with reproducible chest pain, and GERD presents as an epigastric pain that is typically described as a burning sensation. Next question. What is the most appropriate test for a 55-year-old male with a history of smoking, experiencing claudication that is relieved by rest, and diminished peripheral pulses in the lower left leg? A. Contrast angiography. B. MRI. C. Doppler ultrasound. Or D. X-ray. I'll give you a second to review. With a history of smoking, the patient is at increased risk of atherosclerosis. In this case, the patient likely has atherosclerotic plaque buildup somewhere along the right arterial tract, and thus, an angiography would be best served for identifying the extent of the buildup. A Doppler is the best test for DVT, and MRIs and radiographs are less sensitive, making contrast angiography the correct answer. Next question. A 50-year-old patient comes to you for help with smoking cessation. Patches have been unhelpful, and her insurance will not cover Chantix. She's not currently on any medication. Which of the following is the most appropriate therapy? A. Citalopram. B. Bupropion. C. Amitriptyline. Or D. Jardiance. I'll give you a second to review. The correct answer is B. Bupropion is the only medication listed that is indicated for smoking cessation. Next question. A 40-year-old male with a BMI of 35 presents to your clinic with polydipsia, polyuria, and unintentional weight loss. Which would be the most appropriate test to identify the problem? A. CBC. B. Urine osmolality. C. Fasting glucose. Or D. Stool hemoccult. I'll give you a second to review. The correct answer is C. The presentation for this patient is in line with diabetes, so a fasting glucose would be the most appropriate test. Next question. A 55-year-old male with a history of BPH presents with complaints of recent episodes of anxiety that are increasing in frequency. The episodes last 10 minutes and often feature tachycardia, significant diaphoresis, nausea, a feeling of impending doom, and tingling in his hands and feet. He notes that this often occurs at the thought of or during social situations, and he has been self-medicating with excessive alcohol consumption. Of the following medications, which is safest to initiate in this patient? A. Amitriptyline. B. Albuterol. C. Citalopram. Or D. Diazepam. I'll give you a second to review. The correct answer is C. The patient is presenting with anxiety attacks that are not controlled. His history of BPH and excessive alcohol consumption should be considered, as it would be inappropriate to use benzodiazepines with alcohol use disorder. Citalopram is the only medication that is considered first line in the treatment of panic disorder. Next question. Which of the following medications would be most likely to cause peripheral paresthesia in patients receiving quadruple therapy for tuberculosis? A. Rifampin. B. Ethambutol. C. Pyrazinamide. Or D. Isoniazid. I'll give you a second to review. The correct answer is D. Isoniazid is associated with paresthesias in approximately 10% of the population who receive the drug. The higher the dose, the higher the risk. Co-treatment with vitamin B6 can improve symptoms in those who experience this effect. Next question. Which of the following is true regarding cholestatic jaundice? A. There is a decrease in hepatic production of bile salts. B. There is a decreased serum concentration of bile salts. C. There is a decrease in total bile salt availability. D. There is an increase in intrahepatic bile salt recirculation. I'll give you a second to review. Correct answer is C. Total bile salt availability can be decreased in the presence of decreased secretion and bile duct obstruction. Next question. A 40-year-old male presents with a 6-month history of epigastric pain. She states her symptoms improve with eating, but worsen 2 hours later. Physical exam reveals mild epigastric tenderness, but fails to identify a palpable mass or guarding. What is the most likely diagnosis? A. Duodenal ulcer. B. Gastric ulcer. C. Irritable bowel syndrome. Or D. Inflammatory bowel disease. I'll give you a second to review. The correct answer is A. This presentation is consistent with the duodenal ulcer. Gastric ulcers present with pain worse with food. IBS is abdominal pain relieved with defecation, and IBD has a varied presentation based on whether it is Crohn's or UC, but both typically present with diarrhea. Next question. A 27-year-old male presents to your clinic after recently being diagnosed with gout, and allopurinol therapy was initiated. As the patient's gout progresses, what is the most important lab to monitor considering the patient's medication and condition? A. Uric acid. B. Creatinine. C. ALT. Or D. Hemoglobin and hematocrit. I'll give you a second to review. Allopurinol and hyperuricemia can have an effect on kidney function, and though monitoring uric acid levels is a tempting option, monitoring the patient's kidney function is the most important over the course of the disease and allopurinol therapy. Next question. Which of the following is recommended in women with Hodgkin's lymphoma who have been treated to remission? A. MRI of the chest every 2 years for 10 years. B. CT of the abdomen every 2 years for 10 years. C. Annual mammography starting at 40 or 5 years after radiation therapy. D. Serial PTH every 6 months for 5 years. I'll give you a second to review. The correct answer is C. Current recommendations support the use of mammography at the age of 40 or 5 to 8 years after radiation therapy. There is conflicting evidence for the use of CT at varying levels after being treated for Hodgkin's lymphoma. A TSH would be recommended on a yearly basis, but MRI is not recommended over CT in the evaluation of potential metastasis following lymphoma. Thank you for listening to EOR Review. We will be back with another episode very soon.